Hi, I'm Dr. Alan Percy, a pediatric neurologist at the UAB Rett Syndrome Clinic, which is recognized as a center of excellence by the International Rett Syndrome Foundation.
And I'm Jane Lane, a research nurse manager for the neurology division of UAB's Rett Syndrome Clinic.
Some of the most important aspects of care for my patients with Rett syndrome are noting their unique baseline symptoms, discovering their ongoing needs, and observing their individual responses to treatment with DAYBUE. In this chapter, we'll discuss the importance of tracking both symptom improvement and the evolving needs of each patient with Rett syndrome. It is important to understand that Rett syndrome is a neurodevelopmental disorder. This means that impairments occur in the development and functioning of the neurological system and brain early on. Rett syndrome is not neurodegenerative. The nervous system does not progressively deteriorate over time. In other words, the neurons are there, they just do not function properly. This means that it is possible to intervene at any stage of the disease, even in older individuals, and make a positive impact on the signs and symptoms of Rett syndrome. Every patient with Rett syndrome has a unique set of evolving symptoms, needs, and goals, which means each patient's experience with DAYBUE will also be unique. The only way to know how an individual will respond to DAYBUE is to begin treatment.
Some common symptoms that my colleagues and I see in patients with Rett syndrome are abnormal breathing, seizures, difficulty settling at night, gastrointestinal issues which can lead to weight concerns, hand stereotypies, repetitive behaviors, vocalizations, eye gaze, and changes in mood. However, each patient can experience symptoms outside of these common observations. For this reason, I believe it's important to establish a baseline of symptoms for each patient. In my practice, this is done by connecting with a patient's caregiver for updates on the progress of their multidisciplinary care. I feel that being aware of the latest observations from a patient's speech therapist, occupational therapist, physical therapist, pediatrician, neurologist, etc., could help form a more complete picture of the patient's baseline symptoms and needs. After a baseline is established, symptoms, progression, and ongoing needs are tracked for my patients, both in our office and at their homes. I encourage caregivers to provide updates on symptoms, side effects, and feedback on their progress from teachers, therapists, and even siblings for each visit. Are they walking better? Are they standing longer? Are they needing less support? Is hand use better? Are they holding objects longer? And certainly communication through eye gaze. Is that improved? Are they interacting better at home, at school, with therapists, using devices or eye gaze for communication? The most profound one would be from an occupational and/or physical therapist, that their mobility was better. They had more strength in standing, and they were able to stay awake longer to even engage in therapies.
I schedule in-office follow-up visits approximately 12 weeks after starting a patient on treatment with DAYBUE, and again after 6 months. During these visits, I address any new symptoms and record any improvements to those observed at baseline. When evaluating symptoms, I believe it is also important to consider the impact of seemingly small improvements. Their attention is much better. They give eye contact, and that is a problem with girls with Rett syndrome. They'll look at you, but then they'll look away, and they'll look back at you. If they have better attention, their periods of looking at you and interacting and being responsive are longer.
And even augmentative communication devices require that sustained eye contact to work. And families have told us in clinic that alone has been profound for them, because that device is working in school, at home, socially.
DAYBUE can be part of comprehensive care in appropriate patients with Rett syndrome. Every patient with Rett syndrome has different symptoms and will respond to treatments, including DAYBUE, differently. Patients should not expect to necessarily see immediate improvement in symptoms after starting DAYBUE. Our goal is to help improve symptoms and manage them. I had a recent conversation with a family about restarting DAYBUE. They were anxious, of course, because there had been issues with diarrhea, but we encouraged them to begin again, to start at a lower dose, to go slowly, and to pay more attention to other medications that could be used to deal with side effects such as diarrhea. So whether that's increasing the fiber in the diet or using a medication which is aimed at suppressing diarrhea, if that is brought into the picture earlier and we have a slower progression of the dosing, perhaps that can be more acceptable to the caregiver. And I think the parent took that well.
And so we pull in that gastroenterologist that's on our team and on her team to say, okay, we've used what we as a neurology practice are comfortable doing. What can you add to this? And that has been so valuable to be able to do that.
Mitigating gastrointestinal adverse reactions is also an important part of treatment. Be sure to watch Chapter 3, Managing Gastrointestinal Issues, for some helpful tips.
Indication: DAYBUE is indicated for the treatment of Rett syndrome in adults and pediatric patients 2 years of age and older. Important safety information, warnings and precautions. Diarrhea. In a 12-week study and in long-term studies, 85% of patients treated with DAYBUE experienced diarrhea. In those treated with DAYBUE, 49% either had persistent diarrhea or recurrence after resolution despite dose interruptions, reductions, or concomitant anti-diarrheal therapy. Diarrhea severity was mild or moderate in 96% of cases. In the 12-week study, anti-diarrheal medication was used in 51% of patients treated with DAYBUE. Advise patients to stop laxatives before starting DAYBUE. If diarrhea occurs, patients should notify their healthcare provider, consider starting anti-diarrheal treatments, and monitor hydration status and increase oral fluids if needed. Interrupt, reduce dose, or discontinue DAYBUE if severe diarrhea occurs or if dehydration is suspected. Vomiting. In a 12-week study, vomiting occurred in 29% of patients treated with DAYBUE and in 12% of patients who received placebo. Patients with Rett syndrome are at risk for aspiration and aspiration pneumonia. Aspiration and aspiration pneumonia have been reported following vomiting in patients being treated with DAYBUE. Interrupt, reduce dose, or discontinue DAYBUE if vomiting is severe or occurs despite medical management. Weight loss. In the 12-week study, 12% of patients treated with DAYBUE experienced weight loss of greater than 7% from baseline, compared to 4% of patients who received placebo. In long-term studies, 2.2% of patients discontinued treatment with DAYBUE due to weight loss. Monitor weight and interrupt, reduce dose, or discontinue DAYBUE if significant weight loss occurs. Adverse reactions. The common adverse reactions, greater than or equal to 5% for DAYBUE-treated patients and at least 2% greater than in placebo, reported in the 12-week study were diarrhea, 82% versus 20%, vomiting, 29% versus 12%, fever, 9% versus 4%, seizure, 9% versus 6%, anxiety, 8% versus 1%, decreased appetite, 8% versus 2%, fatigue, 8% versus 2%, and nasopharyngitis, 5% versus 1%. Drug interactions. Effect of DAYBUE on other drugs. DAYBUE is a weak CYP3A4 inhibitor. Therefore, plasma concentrations of CYP3A4 substrates may be increased if given concomitantly with DAYBUE. Closely monitor when DAYBUE is used in combination with orally administered CYP3A4 sensitive substrates, for which a small change in substrate plasma concentration may lead to serious toxicities. Plasma concentrations of OATP1B1, and OATP1B3 substrates may be increased if given concomitantly with DAYBUE. Avoid the concomitant use of DAYBUE with OATP1B1 and OATP1B3 substrates, for which a small change in substrate plasma concentration may lead to serious toxicities. Use in specific population. Renal impairment. DAYBUE is not recommended for patients with severe renal impairment. DAYBUE is available as an oral solution, 200 milligrams per milliliter. Please read the full prescribing information, also available at daybuehcp.com.